Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 3rd, 2025. This video is on an article published in the New England Journal of Medicine on July 30th, 2025, titled Motor Vehicle Crash Prevention. In 2021, over 42,000 people died in the US due to motor vehicle crashes, a rate significantly higher than in other peer nations. The safe system approach adopted by US DOT in 2021 targeted system-wide interventions. The principles were human mistakes are inevitable, safety is shared, injuries are preventable, redundancy is crucial. Crash countermeasures fall under 6 pillars: safer people, safer roads, safer vehicles, safer speeds, post-crash care, and system-wide policy. Young drivers face highest fatality rates. Graduated driver licensing laws or GDN laws, monitoring systems help mitigate risks. Racial and ethnic disparities persist in fatalities. Higher fatalities among Native and Black populations. Distracted driving accounts for 29% of the crashes. Bans have mixed effectiveness. Safer roads include traffic circles, barriers, lighting, and infrastructure changes reduce pedestrian and cyclist deaths. Safer vehicles, active systems like automated emergency braking, lane warnings, driver monitoring technology, and passive systems are airbags and seat belts are crucial. Speed enforcement, automated and high visibility, and faster EMS response reduce fatalities. The Hayden Matrix guides holistic crash prevention strategies. What is the safe system approach? It's a comprehensive safety framework that recognizes human fallibility and emphasizes shared responsibility, proactive design, and injury reduction. The 6 core principles of the safe system approach are: 1. Death and injury are unacceptable. Humans make mistakes. 3rd, humans are vulnerable. 4. Shared responsibility. 5. Proactive safety. And redundancy is essential. How high was US motor vehicle death in 2021? 42,939 deaths, among the highest rates in the developed world. Why are younger drivers considered high risk? They have higher fatality rates, inexperience, and risk behaviors like distracted or impaired driving contribute. What is GDL, or graduated driver licensing? It's a phased approach to licensing teens that restricts high-risk driving conditions until experience is gained. How do racial disparities manifest in crash data? Native and Black pedestrians are 5.1 times and 2.1 times more likely to die than white pedestrians, respectively. What percentage of fatal crashes involve intoxicated drivers? In 2021, 31% involved drivers under the influence, DUI. Which substances are most often found in fatally injured drivers? Alcohol, followed by cannabinoids, stimulants, and opioids. What role does seat belt use play? Non-use contributes to 50% of vehicle occupant deaths. Overall usage is 92%. We got an 8% opportunity there. What is the impact of distracted driving? It contributes to 29% of all crashes. Young drivers are especially affected. What countermeasures exist in distracted driving? Laws banning phone use, vehicle-based alerts, and driver monitoring systems. How do safer roads reduce crashes? Features like roundabouts, better lighting, and pedestrian and cyclist barriers lower injury and fatality rates. What are the active and safe passive vehicle safety systems? The active prevent crashes, example automated emergency braking or AEB. Passive, they reduce injury in crashes like seat belts and airbags. How does speed enforcement affect safety? High visibility and automated enforcement reduce injury crashes by up to 25%. Why is EMS response time critical? Delays correlate with higher mortality, especially in rural crashes. What is the Hayden matrix? William Hayden Jr., a Harvard educated physician and the first director of the U.S. National Highway Traffic Safety Administration, developed a conceptual model that analyzed injury events by phase, pre-event, event, and post-event, and by factor, host, agent, vehicle, and environment. It integrates public health and engineering strategies shaping traffic safety policies worldwide. It shifted injury prevention from blame, example bad drivers, to system design, example safer roads, better EMS. His model influenced seatbelt laws, crash testing, helmet mandates, and trauma system development. What is this New England Journal article's core call to action? It wants to implement and expand crash prevention strategies across all stakeholders to move towards zero deaths. Several crashes changed the law. One of them was the Mansfield Bar, is a nickname for an underride guard installed in semi vehicles. Jane Mansfield, who was in her 20s in 1967, died because her car underneath the guards for the trailer got stuck under a trailer. Princess Grace of Monaco and a film star had a fatal crash. After that, the advocacy for seat belts started. Princess Diana had a fatal crash. After that, privacy rules and seat belt regulations in the rear seat became popular. Ryan's Law, phone use was banned in school zones. And these are some of the many crashes that changed the law. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.